On the issue of the CHIPS compounds, Haruna, your points on that?
Thank you, Bless.
Yes.
I think that the most essential part of his question was not about construction of CHIPS compounds, but the abandonment and non-usage of some of these facilities where essentially workers are inadequate or even non-existent. And then the second part of his question was about lack of refrigerations at these particular centers. And
also the health workers, yes.
Yes, so there was a third part of the conversation within his question. What I would have to say is that CHIPS compounds constructions have never been abandoned, not directly to him, but to correct my brother here. CHIPS compound system started somewhere in 1994, and I happens to have worked at the health administration for 3 years before exit to another institution. And this particular concept under President Kufuor continued, and more infrastructure was being developed and opened up to communities and villages who hitherto would have to go a longer distance to access healthcare services. Yes, workers at those particular CHIPS compounds are clearly being designed. From his question, I believe that we would call on and make input to the health directorate, the Ministry of Health, to take a stock of the health strength, the staff strength of all these particular CHIPS compounds, for us to be able to see where that staff has to be provided.
Okay.
Yes,
but in terms of policy
I'm coming
to
on
tackle
there.
that. Yes,
I'm coming on there because he came on a question that is based on certain strands.
Right.
In terms of refrigeration, I know perhaps he's coming from the health sector. We all know the cold chain system within the health infrastructure is being run by the disease control at the health unit, that is the district health management unit, the DHMTs, where the cold system is being run. At the CHIPS compounds, some few systems of cold reserves are being used at those particular places, and that could be the cause of which refrigerators are not being provided more essentially to some of these particular CHIPS compounds. If it is so that necessary, I believe that as this is coming from the citizens of Ghana, government will essentially make sure that the health sector will take this particular
so policy again,
to be able to look at it.
You're going
in terms of policy.
Yes.
In terms of policy, health production. You know, we are the first government that has invested hugely on health infrastructure in Ghana since the inception of the Fourth Republic. We are the most government that has invested so much on health infrastructure in terms of the provision of district hospitals to districts that has no hospitals, in terms of completion of abandoned health infrastructure. I
get that. Well, that's your point. But the issue about policy and what you intend to do, because he has the concern. How would the NPP's manifesto deal with that specifically? I mean, you can box the two issues.
Yes, that's what I'm saying. In terms of the workers, we are going to take stock because we are the government. We have recruited so far about 187,000 of health professionals into health institutions where they work.
So you will take stock?
Yes, we will take stock.
That's your
and then
recruitment
approach will be done and sent to some of these particular places. And in terms of the refrigeration is asked, I've also given a response to that where the cold chain system is being run. By the Ministry of Health, if it is so critical that refrigerators should be provided to this particular CHIPS compounds, that should be done through the Ministry of Health, direct to the Ghana Health Services.
So will that feature in your manifesto? Because you seem to be talking about what's happening. Surely, health is one of the essentials, and I've told you that specifically to his concern.
Yes, that's what I've addressed. Bless, if you give me the opportunity.
No, I get it.
I'm answering.
You seem to be talking about the Ghana Health Service. We want to know what your manifesto will
Our
do
manifesto is so critical on the provision of health services to the citizens of Ghana, and that is what we are going to focus on, to ensure that infrastructure is provided, to ensure that health personnel are being sent, to ensure that health institutions will get the needed support to be able to recruit and then train nurses. Let me put